Broadcast is now starting. All attendees are in listen-only mode.
Welcome, everyone. We're going to get started in just a minute, but wanted to open up the broadcast here. Glad to see so many people are coming on. We'll start speaking in a couple minutes, or a minute. All right, we will go ahead and get started as people are still logging on, but we want to use our full hour today. Thanks for joining us for our monthly Strengthening Families Networking webinar. Today we're focusing on building protective factors in a family resource center setting. And I'll share a little bit about this series of webinars. We do this once a month on the second Thursday of the month at this time. It's an open invitation to anyone who's using Strengthening Families, whether that is at a local program level or coordinating a state initiative or in another organization that's using the Protective Factors framework. And each month we jointly convene these between my organization, the Center for the Study of Social Policy, and the National Alliance of Children's Trust and Prevention Funds, our partners. We have a topic each month, usually with a guest speaker, and we coordinate that either through CSSP or the Alliance or a member of the Strengthening Families National Network. We always put the recordings and materials on a site maintained by the Alliance, which is at this point a fantastic archive of Strengthening Families topics for many years now. So a few days after the webinar, sometimes the day after, but I don't want to promise that, you can go to that website and find the recording, handouts, and the slides from this month's webinar, and you can always go there to see the archive of past ones. So what do we have coming up? Our next one is on August 8th. We're going to focus on state and regional implementation and how they're coordinating between those two levels in Kentucky. And then on September 12th, we're going to hear about a county-wide community-driven Strengthening Families initiative in Lane County, Oregon. So both of those are going to be great topics. Put them on your calendar now. The official registration information will come out as we get closer to them. We also, I hear someone saying the volume is too low, or saw a comment. Thank you, Becky, for typing that in. I'm just going to hold the mic closer to my mouth and hope that works. If it's still quiet, please let me know. So each month we send out the announcement about this webinar in a newsletter, the Strengthening Families e-update. You can subscribe to that on our website at cssp.org. At the bottom of every page, you can click to subscribe to any of our newsletters that you'd like to stay in touch with. And you can also find that registration information on our events page for the upcoming webinar and on the Alliance's Google site that I just mentioned. You can always contact me if you'd like to suggest a topic or a guest speaker, or if you want to volunteer to share your work. We're always looking for exciting ways people are implementing and thinking about strengthening families, and welcome your suggestions. All right, so today's agenda is pretty straightforward. I'll be sharing some updates from the Center for the Study of Social Policy. Then we're going to hear about the 5 protective factors in action from Malcolm Gaines at the Safe and Sound Center in San Francisco. So a few updates from CSSP before we get into our main topic. Our parallel framework of protective and promotive factors for youth, Youth Thrive, in the last few years developed a web-based tool for youth to respond about their own protective factors. It is similar to our parents' assessment of protective factors. However, this one was designed and conceived from the beginning to be a web-based tool. It was initially made available only to certain organizations that were participating in a network. It is now available to anyone free of charge, which is pretty exciting. So I encourage you, if you are working with a youth serving organization or if you're coordinating between Strengthening Families and Youth Thrive implementation in your jurisdiction, that's a survey you can use. It's a great system that will print out reports and give you some options for data analysis. I encourage you to explore that. Another new resource from CSSP that I thought many of you might be interested in is a new blueprint about leveraging Medicaid and CHIP to support social and emotional health. The blueprint goes through these 5 strategies in great detail, and I'm not going to read through them now, but I will point out that you can download the blueprint from our website. There was also a webinar on it about 2 weeks ago, which you can listen to the recording of there at that Vimeo link, or if you go to our website and search the resources for Medicaid, these are the first things that will pop up. So thank you for someone typing in, letting me know you can hear me. I'll just keep holding the mic up here. The other thing I wanted to share is a recent update. I know that many of us are very concerned about what is going on with immigrant children and families right now, and both of the sponsoring organizations of this webinar series have put out statements recently. So CSSP has a statement, a press release called the Trump Administration's Systematic Dehumanization of Families, and the Alliance just yesterday put out a statement calling for an immediate end to the immigration policy which abuses children. Really encourage you to look at those, share them, consider whether your organization would be in a position to make a similar statement, and let us know if you have questions about that. Related to that, in March, CSSP put out a tool, a resource called Our Future Together, a framework for an equitable immigration system that protects and promotes the well-being of families. As you can see, or at least somewhat see here on the screen, the blueprint, I'm sorry, this one's a framework. The other one was a blueprint. This framework goes through ways that we can discard harmful policies, protect from further harm, and promote well-being for families at the border and for families that are already in the U.S. If your organization or you as an individual are interested in advocating for these types of changes, I encourage you to check out that resource. And there's a blog post about it and other tools you can find on our website, but the direct resource itself is there just at cssp.org/resource/ourfuturetogether. All right, I am excited to get us into our topic for today, which is about building protective factors in a family resource center setting. And before I hand it off to Malcolm, I just wanted to mention, because I know that many of you joined the webinar today because you are interested in family resource centers or running or funding family resource centers, I always encourage you to check out the resources from our partners at the National Family Support Network. Their website is there. They are the home of the standards of quality for family support and strengthening programs, and have other resources, webinars, etc., for supporting implementation of protective factors and general family strengthening work. So we're going to hear today about very specifically how the Safe and Sound organization is operating in San Francisco, but I wanted to make sure that we gave a shout out to our partners at the National Family Support Network, who have a lot of other resources you might want to check out as well. I do see that someone has raised their hand, so I'm going to check who that is and also let you know that you always have the option of raising your hand to be unmuted if you have a question. You can also type a question into the chat box, or if you have a question or comment, if you have a clarifying question while Malcolm is talking, feel free to type that in and we'll get it in there. Or you can raise your hand and we'll unmute you so that you can speak if you're in a good place regarding background noise and all of that. And at the end, we'll have specific time for discussion and questions. So feel free to type those in as we go. We can get to them at the end. And with that, I'm going to hand off to Dr. Malcolm Gaines from Safe and Sound in San Francisco, who's going to be presenting about how they're doing their work there in San Francisco. And I think it has good lessons for all of us. So I'm going to make Malcolm the presenter and let him take it away.
Okay, thank you very much, Kaylin. It's a pleasure to be invited to do this. Thank you very much. So I'll, oh, my screen doing that, okay. So we're gonna go through today basically how Safe and Sound has implemented the Strengthening Families framework at our center. It's one of many ways that this material and this framework could be implemented, and I offer it to you in the spirit of wanting to sort of let people know what we're doing, and if it's useful to you, or you want to let me know at some point what you're doing, and we can share some information and continue all of our learning about implementing the 5 protective factors. I'm really interested in that too. So if some of this is interesting to you and you'd like to know more, just let me know. So here we go. I've organized our kind of agenda for this today. I'm going to give a little bit of just introduction of Safe and Sound, just sort of in the context of our work and talk a little bit about how we got into using the 5 protective factors and sort of what our rationale is for that. I don't need to make a case probably for anybody who's on this that the 5 protective factors are a good thing to use, but I did want to talk about just sort of how we think about it and why it's why we've hitched our wagon to the 5 protective factors, and then dig into really how we've implemented the 5 protective factors and the Strengthening Families framework in our center. I'll describe to you sort of the way we've organized ourselves around those factors, and can show some of the tools that we're using around intake and engagement with families, around assessment, goal setting, and service planning, and then give you a little glimpse of sort of how we're using the data that we're getting back from those tools to support our work. And then we've also begun some conversations here, and I know there are other conversations around the country and perhaps among some of you around the concept of community protector factors and what it would mean to take these individual or sort of family level protective factors and try to understand their implications for implementing them at a community level, and what other factors we might consider when we're trying to do community protective and prevention work. So here we'll go, and certainly feel free as I'm going along. I'll check in with Kaylin as we go around whether anybody's raised their hand or has any questions as we're going. And I hope that there will be, my plan is for there to be plenty of time at the end for questions and discussion as well. But feel free to let me know if there's something that you want to know more about. We can certainly take that time as well. So who are we? Safe and Sound. We're located in San Francisco. We've been around for since the early 70s, so a number of decades doing family support work. We are a family support and family resource center in San Francisco. We are also a child abuse prevention center. We house our county's Child Abuse Prevention Council, and so that's kind of, in terms of where we're situated, that's who we are. Our mission statement is very simple: prevent child abuse and reduce its devastating impact. And we want to implement that with the goal of ending child abuse in San Francisco and reducing it throughout our region in the space of 2 generations. So we're trying to hit in 50 years, although I think it's about 45 now. We started with this goal about 5 years ago of really ending child abuse in San Francisco. And we certainly can't do that by ourselves, which I'll talk about a little bit, but we keep that in mind because we can't imagine sort of what child do we want, what child would be left out if we were ending some abuse in San Francisco. That's not really the right goal for us. So that's what we keep in mind for all of our programs and our work. We take a public health approach to this work and use this socio-ecological model for thinking about the problem of child abuse. Many of you probably are doing the same thing or familiar with that, but you'll see that as I talk a little bit more about what we do, we try to have programs and activities at our organization that are that hit sort of each of these levels of the socio-ecological model. And the implementation that I'm going to talk about in detail today really focuses on the center of this, the child and the family themselves. In order to hit those different aspects of the socio-ecological model, we provide family support at that innermost level. We do community education in our San Francisco community. We collaborate with many, many partners. That idea that we can't end child abuse by ourselves, certainly in our own little shop here, but there are so many partners in our city and in our region and around the country. We need to view ourselves as in partnership and collaboration toward this goal. And we also do some advocacy work at that societal level of the socio-ecological model of really trying to advocate for policies that work toward prevention and supporting families in our community and in our society. So given that, our programs really rely on having a child-centered orientation. We work mostly with parents, and family support centers and family resource centers tend to sort of work mostly with parents, the active work, but really keeping the child in mind in everything that we do. We're trying to incorporate, and in the model I'm describing today is one of our efforts toward this, data-informed decision-making. I've talked about us trying to use a public health model to think about the problem of child abuse. And of course, the 5 protective factors is sort of the way that we're, sort of the how of what we're going about, the way we're going about this work. So why the 5 protective factors? Again, I don't need to convince anybody on this call probably of why they're a good thing in themselves, but in terms of why we use them, we do at our Family Resource Center, we do a lot of parent education. We also do a lot of staff and volunteer education. Our Family Support Center happens to use a great number of volunteers in our work, and so we're trying to sort of in order to educate our staff and volunteers about the framework for our work. The 5 protective factors is very useful for that as well. And then guiding the services that we provide to families using this framework in the way I'm going to describe, we've just found is the most useful thing we found in order to do that. We have taken the protective factors and the Strengthening Families framework and really tried to take the step of making the protective factors themselves become the outcomes that we're working toward, become the things that we're measuring in families. Which we can't do perfectly yet, maybe never perfectly, but we can't, we're still working on ways to measure those and ways to understand how to measure those. But the protective factors are really the North Star outcomes of all of our work. And the model that I'm going to describe sort of tries to reflect that certainly. And therefore, we're able to support our data-informed practice using the Strengthening Families framework to support the data. So that's a little bit about why we're using this framework at our center. We also think about the 5 protective factors as something that really goes hand in hand with thinking about adverse childhood experiences and ACEs science. We know that one of the great things about the adverse childhood experiences study was that it so clearly connected what we already knew intuitively for a long time, that early experiences early negative experiences are connected with later negative outcomes. And we also know that the effects of ACEs or risk factors are cumulative in a person's life. We need more science about this, but we do really feel like the protective factors themselves ought to go hand in hand with assessing ACEs and risks. They really ought to go, we ought to be assessing protective factors and strengths in families together in order to give the best chance for the prevention work that we're doing. I think Charlene Harper Brown suggested in one of her papers that protective factors themselves may also be cumulative in a way that ACEs are. And I, for one, want to know more about that and want to suggest that seems right to me and we need to learn more about it. But again, that's sort of why protective factors, we feel like if we can bolster family strengths in this way, that can have a cumulative effect. And also the work that we do with families is really trauma work. And so most of our work is oriented around a trauma recovery model as well. And we have found that the protective factors model is really congruent with that. And if anybody's interested in knowing more about how we're beginning to unify those models, I'd be happy to talk about that as well. So let's dig into the implementation. How do we do this? So about 5 or 6 years ago, we started to design the kind of programming that I'm going to describe, and it's really organized around 2 principles. And the exact way that we've organized ourselves around these, I think, it may be interesting, but it's not really the meat of it. I think if for other family resource centers that are implementing this, it has to be done in the right way for that location, for that program, and given the resources that center has and for the population that they're serving. But these are really the principles at work throughout the way we designed this. Care coordination and a team-based approach, rather than just delivering different services to families based on their need, which can be a good way and a responsive way of serving families. We really wanted to bring together the different kind of programs and services that we provide, and also the different kinds of programs that families access outside of our center, and bring them together in a coordinated way to pursue these protective factors as the outcomes, to pursue the goals that families articulate for themselves, that really we found almost always can be incorporated under this rubric of protective factors. So those are the things that work here in the way we designed our program, which looks sort of like this. If you look at the sort of lavender circle that says integrated family services, what I'm going to describe today describes mostly what happens sort of inside that bubble. When families engage with us in a certain way, when they have a certain level of vulnerability and we offer a level of engagement with them that's a bit more intensive, That's the program I'm describing today. But surrounding that and next to that is a whole suite of services that we're not necessarily tracking outcomes for, that families can access in sort of an a la carte kind of way, where we can really meet them at a level of engagement that they're comfortable with. We call that supportive family services, and that's an essential part of the work that we're doing, because it allows us to meet families where they are. If they're not ready for or interested in the kind of programming and level of engagement that I'm going to describe today, it doesn't mean that we can't work with them. It just means that we're going to meet them where they are at perhaps a more distant or less intense level of engagement, but we're still using the protective factors to organize the way that we're serving them. It's just not as intensive or organized in this particular way. So that's kind of a description of the broader programmatic way that we're looking at this work. And let's dive into, what does integrated family services look like? That's just what we call it, but it can be called anything. But here are some of the central elements of it. It's really this team-based approach. You see in the center that the clinical care coordinator and that person's relationship with the family is really at the center of the work that we're doing. The clinical care coordinator is responsible for engaging with the family and talking about what their goals are and designing a service plan. And I'll show you what our service plan looks like a little bit later. But for that primary engagement, and that person's responsible for measuring the outcomes with the family, measuring their progress toward their goals, and keeping our team and the family together sort of oriented around the protective factors and the family's goals. And then the other circles here, the lavender ones, the ones that are filled in happen to be the in-house services that we offer at our Family Resource Center, and the ones that are surrounded by dotted lines just represent possible outside resources that a family may be accessing in addition to our services. And so we really think of this as the care coordinator as somebody who's pulling all of that together. Ideally, it doesn't always work perfectly, but that's the role that we have for them. So with that sort of hub and spokes kind of design and team-based design, let's take a look at the tools that we use to engage with families. We assess protective factors, or we screen kind of protective factors right from the get-go with families at intake. Our intake interview is organized around the protective factors, the questions that we ask. And the person doing the intake may or may not engage with the family about the protective factors in that model themselves, but it's present for that person doing the intake, at least from the very beginning, and we organize the information that we get from families in that way. Again, from the get-go. If anybody's interested in taking a look at our intake interview or any of the materials that I described today, you're more than welcome. I'm going to make sure that Kaylin has copies of them to put up with a recording of this webinar so that it can be downloaded in any way. So, but the point being of this piece around intake and engagement is when the family walks in the door, whether or not they're going to enter this sort of level of service of integrated family services, we're looking at it through a protective factors lens. And at the same time, we're also looking at families' vulnerabilities, risk factors. We don't do the ACEs survey at our agency. It's not quite the right fit for the way that we're working with families, or what families are, or the setting that we're working in. But we do use a risk screening tool that I want to show you. That if you look at some of the items on it, you'll notice that there are items on it that are some of the items on the ACEs survey or that are related to that. So we're really, again, putting protective factors and risk factors together again from the very beginning. We have a high risk, medium risk, and low risk set of items. So after the intake is finished, the provider who did the intake is checking off whether any of these particular items are present. And that helps us understand, in addition to understanding where families' protective factors are, getting that picture of risk and vulnerability and strengths and protective factors at the same time. We found that these are the sort of highest risk experiences that families can bring when they come, and that are most highly correlated with the risk of child abuse. So if a family has any of these items, and some of them certainly have multiple, we really want to make sure that we engage with them right away and as intensively as the family is available for. These sort of medium risk level, these are items that are actually sort of more that aren't as highly correlated, but that really raise red flags for us and make sure that we want to engage with the family. And then low risk, these are more kind of demographic sort of items or items about a family's community that themselves, if they initially presented with just one of them, we wouldn't say, oh, this family's at high risk, but we think of them as things that, again, that can be cumulative or things that could add to high risk or medium risk items and increase the risk further. So these are the tools that we use at intake and engagement. I should say we also administer a PAPF, Parents Assessment of Protective Factors, to families when they come in the door. So we, and not everybody's able to complete it at that point, but for the families that are, again, we get that at both sides of the story around protective factors and risk. So that's our intake, kind of the tools that we use in our intake process and our engagement process. And when families are ready to, and when we're ready, mutually ready to engage in this sort of integrated family services model, we do a deeper assessment of the protective factors. We use, again, the Parents Assessment of Protective Factors, and then we also use an adaptation of the North Carolina Family Assessment Scale, which is the tool that was published for use in child welfare settings, but we developed a sort of a crosswalk for the subdomains of the NCFAS, North Carolina Family Assessment Scale, crosswalk that allows us to sort of translate the subdomains of family functioning for that tool over to the protective factors and generate sort of a protective factors scores. I'll be showing you some of the data from that and what that looks like. But those are our two main tools that our care coordinators use when they are engaged with families. We administer them every 3 months as well as we can. You know, families' lives don't always allow us to do that in lockstep or right away, and we're certainly responsive to that. But our target is to try to get a picture of what's happening with the protective factors in a family every 3 months. And then we use these tools to help develop a service plan with a family. So you can see that this is sort of a sample one, that for each goal, it's related directly to a protective factor, and we're always talking with families when we do that sort of mutual development of a service plan with a family. There's listening to the family and what they articulate their needs to be, of course, and then there's also taking some of the information from, say, the PAPF and the NCFAS that may not be obvious in the family's presentation or their articulation of their needs, and allows us to see what some of the deeper or other needs might be. Whether or not they need to be attended to right away, or whether there are things that need to be attended to once a crisis in a family has sort of been stabilized or some other work has been done. All of that thinking can be put onto a service plan like this that we connect with directly with the protective factors, and the family sees this and agrees to it with a care coordinator, and they see that we're working with the protective factors, and we're talking with the family about that as much as we can. And some families don't necessarily find that framework as useful, or they don't think about it exactly that way, but it's a useful tool for our care coordinators regardless. And so we create a service plan with items that are related to the protective factors, and then connect each service to a goal. So what we end up doing is, rather than just having a list of services that need to be provided, we have a list of goals that need to be achieved. And designing a service plan in this way can allow the family and the care coordinator to be focused on those goals, rather than only, you know, did you make that call about getting housing, or did you go to that parenting class? It allows us to keep in mind, why are you going to that parenting class in the first place? What are the goals that you have for your family? So that's a really quick rundown of some of the tools that we use. What happens in our process in that sort of integrated family services plan is that it's really an iterative process. We engage with families, we get some baseline measurement and baseline engagement with a family and begin to develop a relationship with them. And this process is really iterative. Every 3 months or every so often, we do some reassessment. We check in about, how is this service plan going? Is this the right service plan? Did we identify together the right goals for you? Do we need to chuck those goals now that something else has happened in your family and redesign a service plan? Or are there adjustments that need to be made? So the way we designed our program allows and really enforces that kind of process of paying attention to what we're doing with the family all along And sometimes it ends up being a longer interval than every 3 months. Sometimes that's too fast to look at change in a family, but that's okay. The system is that we have here is really designed to be able to keep track with families of their protective factors and of their strength building. I'm going to take a pause really quick, and Kaylin, if there are any questions that have come in or comments that you have or questions that you have about what I've said so far, I'd be really interested to hear those.
All right. Well, we had a couple people asking if they can get their hands on the template for the service plan as well as the tools. So
Yeah.
I am reassuring people we will post those after the webinar along with the recording. And
Absolutely.
we do have I will explain a little bit more. The handout for the slides is available, and someone was having a hard time finding it. If you look at the panel along the side of your screen, you might need to expand it by clicking on that orange arrow. Then there's a little one of the levels, it's like audio and other other options. Then you can click on handouts, and there's a PDF there that you can download. So someone was having trouble finding that. I hope you can get it. We do have a question here coming from Rebecca Mather in Wisconsin. She says, do you have a process for results of assessments directly with families? I guess sharing the results of assessments directly with families, or is that simply incorporated into the service plan?
You know, our care coordinators have the option of sharing the results of those assessments with families. They really have a wide discretion in whether or not they actively do that. We have found that some families find that very useful, and that kind of visual and more quantitative way of looking at what's happening is useful for them. And some families, it really turns them off to try to sort of look at something quantitative that way, and that kind of data, that kind of information isn't useful. So we don't have a specific process or a mandate that care coordinators have to do that. I encourage them to offer it to families if it seems appropriate, and if it seems like a good way to engage with them. And you're right, it would be kind of at the point of doing the goal setting and service planning process. And it would be at the point of that sort of every 3 months or whatever interval it is, ideally 3 months. That's when we would do it, and we leave it optional. I think it's a great idea to be as transparent as we can with people about, they're answering all these questions. What are we doing with this information? We in order to engage with people from a position of trust, that needs to be available to clients as they want it, but not everybody wants it, is what we found. I hope that answers your question.
I think it did. Becky can type in if she wanted to hear more, but that's very helpful. We do have one other question, and if you answer this one, then I think we can move on through the rest of your presentation. My colleague David Willis is asking, I'm wondering about the service planning and goal setting around the 5th protective factor of social and emotional competence of children. What do families often bring to service planning to address social and emotional competence? Wondering how this protective factor is operationalized from the parent perspective.
Yes, thank you. So a lot of times families will come in to our center because there's a particular problem that the child seems to be experiencing. Very often it's in school, or a behavior problem, or a behavior problem that they're having with their kid. And so we find that as an opportunity to not only do some parent education, and that tends to be more towards the, of course, knowledge of parenting and child development protective factor, but in our center we are also able to offer services directly to children, and we provide mental health service, so psychotherapy for kids and families if that's needed, but also our children's playroom, which is nominally the sort of child care that happens when families are here, but it's very much oriented toward building social and emotional competence of children. And so talking with parents about helping a child, as developmentally appropriate, of course, develop their capacities to express their needs in a constructive way, develop their capacities to regulate their emotions, develop their capacity to build positive relationships with peers and caregivers. We speak very directly with families about these as goals, potential goals for their family. And for some families, that's not, it's not the case, and they don't need that. But no items like that appear on the sample service plan, but very, very often that's really deeply embedded. Those kinds of goals are deeply embedded in the work that we're doing with families. we happen to be able to provide services directly to children to support those kinds of goals at our center. But even for family resource centers that don't have those kinds of services, it's certainly something that we can incorporate in discussing with parents as goals specifically. So I hope that gets at what you're talking about. Let me know if you need more.
David said fabulous, thanks. And so I think we can keep going,
You're welcome.
and folks can keep typing in their questions that we can get to the next time we take a little pause like this.
Okay, great. Thanks, Kaylin. So I'm looking at time. I think we're good. Let's move to. So here's some of the data. This looks like it's not very easy to read, and it's actually not. But I'll try to sort of simplify it. So if we think of what the data that we're going to look at are NCFAS protective factor scores. I also have some sample PAPF protective factor scores, and I have a little bit of data sort of in aggregate from one of our data analyses, kind of as a sample of what is possible to do with data like this when you're looking at your population and the work you're doing. So this is a sample protective factor, set of protective factor scores from a NCFAS. Just what you really need to know about the way we score this tool is that you get a positive strength score and a negative challenges score for each protective factor. That makes it kind of complicated because then you have 10 data points that you're looking at. Yes, 10. But what it allows us to do is what you can see here is that below this 0 line, for this particular tool, 0 is the baseline. It's kind of an adequate level on any given item. And when you aggregate them in the way that we do, and again, if anybody wants more information about that, I'm really happy to provide that. What you end up with is, say this would be a negative score on the parental resilience. This would be a negative score on concrete support for a family. This would be a negative score on knowledge of parenting. And so you get a visual on what seems to be, and this may or may not be congruent with the family's own experience, and of course you have to check that out, but this offers one point of view about what seems to be some of the family's challenges. And in this one, it looks like the concrete support for the family is really might be a priority here. And then maybe knowledge of parenting might be a next priority. So you get sort of where the challenges are, but you also get a little bit of information about what the family's strengths are. There's some strengths here in this family for social and emotional competence of the child. That's what this little bar represents. And one could, of course, design a different way to represent this. It's easier to read, but essentially, what you might want to do is talk with the parent. If you see this strength here, you might want to talk with the parent about what are these strengths. Look at the items from the NCFAS that are loading onto this strength score, and it allows you to engage with a family about that, and not just what the challenges are, which is why we score it that way. Why we score it in the way of showing challenges and strengths on each protective factor. And this can be give some guidance to the care coordinator about maybe where to start with a given family. And in this particular family, I'll go back to the service plan. Housing was this sample actually comes from a vignette about a family. And so for this particular family and this particular story that we used, housing was the main concern, medical care for the parent, right? And those are items that would load on this concrete needs, right? And that's why, so you can see a little bit of a relationship here between these scores and what appears on this sample service plan. Okay. We can also look at the PAPF protective factor scores. The PAPF provides scores for 4 protective factors, not 5. We can talk about what that rationale is. But what we have here is, and the PAPF is the parent rating. So this is what this parent, Barbara LeFeaux, is scoring herself. And what we show is, what we want to look at on the PAPF is whether any items are below 2, whether any scores are below 2. And the one that shows up here is around social support, okay? So this parent might be prioritizing her relationships and social support for her family. And if we go back, again, what we've put on this service plan is attend to family events. We happen to do a bunch of family events for families, so that's that's a service that we could provide. So you can begin to see the relationship between these tools, this kind of data, and what appears on a service plan. Okay, and we also put increased use of positive discipline attending a triple P class, which you may or may not include. But so that would represent the knowledge of parenting domain. So you can see whether or not you use these particular tools or not, the idea of introducing some qualitative way of measuring protective factors gives the care coordinator and the family another tool for another perspective on what their goals might be. So there's that. Let me show you one more data slide, and then I'll take a few more questions. So you can also then, when you're collecting data, of course, in aggregate, you can do some analysis of the work that you're doing. This one happens to be one of the slides from our data analysis for last year that I found most interesting. What we have here is scores on the NICFAS. This represents aggregate NICFAS scores across our population. And then just at the time interval, baseline, 3 months, 6 months, 9 months, 12 months, 15 months. And what our data guy pointed out to me and to us here was that we've sort of ended up with a kind of two populations, two subpopulations that we're serving within our program. One follows this sort of blue line where there's a bit of a decline over the first 3 months. And I should say, when we started looking at data for our work, this decline from baseline to 3 months was present with almost every single family and every single data analysis that we did. And we were really kind of scratching our heads because we really want people to be getting better right away. Why is this happening? But what we realized is it's a matter of engagement with families. You don't always, of course, get the full story at that initial assessment point. And it takes time for families to trust and give more information. And unfortunately, most of that more information consists of often challenges or negative things that are happening in the family that they're not quite ready to disclose yet. And so 3 months, at the 3 month mark, it looks kind of worse from this quantitative point of view than at baseline. So that's how we explain that decrease. But if we think about these two subpopulations, we really have some folks that once we begin to engage with them, their protective factors increase pretty quickly. They level off over time, but they're the families that we are sort of successful with from the point of view of having the goal of increasing protective factors. But what about this other set of families? They go down, then they go a little further down, but then they sort of level out. What does that mean? And what we think we understand about this is that these are the families who, for various reasons, circumstances in their life, other challenges that they may be having around past trauma, for a whole host of reasons, our work with them might not be to, and maybe our goal shouldn't be for these particular families to increase their protective factors. It might be to help them maintain where they are, to help keep them from getting worse. And so we think of these two groups as sort of our growth group and our maintenance group. And it may be that this kind of this picture wouldn't hold true across family resource centers, but it's an example, or other ways, organizations that work with families. But it's an example of what the kind of data analysis you can do when you're collecting information like this. So I'll take another pause. Is there anything anybody wants to talk about more or clarify?
This is great to see, Malcolm. I'm really appreciating the separating out those two subgroups, because otherwise your line wouldn't show the strength that's happening in those growth stories. It also wouldn't make it as clear that some families are, maintaining, and allow you to explore what that means and how to do that and how to maybe move them towards the growth stories as well. We do have one person who raised her hand. I'm going to unmute Kim and see if she is able to speak. Sometimes hands get raised by mistake, so we'll check. She is also self-muted. So Kim, if you would like to speak, please hit your own unmute button and we will hear from you. But at this point, nobody has typed in any other questions, so I think you can keep going and maybe we'll... Oh, Kim, are you able to speak now? It looked like she unmuted herself, but I don't hear her. So let's go on. And oh, we did get a question. All right. There's always a little lag as people type in. So the question is from Debbie Wynn, and she says, do these two assessment tools give the charts of results, or did you create those?
Give the charts of results.
I think she's asking whether the assessment tools automatically generate those kinds of
Oh,
charts.
these charts. We created these using the data system that we have. We have a great data guy, and he helps a lot with this. We created this NICFAS chart. The reason that we had to create this one in particular is because we were doing that crosswalk from the NICFAS domains, from the published NICFAS domains to the protective factors. The NICFAS, actually, if you buy it, it comes with a data system that will do some output for those domains. But we weren't using those, and so we had to create our own. The PAPS doesn't itself, there's no particular tool published to create this kind of chart, and so we had to use our own data system to do that. But it's a pretty simple enough tool that it's pretty easy to create something like this. Even if you don't have a sophisticated data system, you could do it in Excel or something if you've got somebody with that expertise.
Yeah, I will say the PAPF has a scoring sheet that for an individual family leads you to chart those out, but aggregating it would be something you'd have to develop a tool, use a tool for.
Right, exactly.
David Willis asked another question. Has this data been able to help you to determine what factors help move families from maintenance to growth and bring great precision into that process?
That's our hope. This particular information out of the data analysis we've just had for a couple of months because it's analysis of our 2018 and past data. So we're still kind of digesting it and thinking about what the implications are for our programming. We need to do some more sort of understanding about who in particular are in these two groups and what kind of services they have participated in and what sort of demographic, if there are any demographic differences between them. So yeah, the next step would be to understand what some of the differences are on those factors between these two groups. And then yes, that would certainly allow us to either to understand more about how to move families from maintenance to growth. It would let us know whom to talk to, which families we could go to them and talk with them about their experience and see. So this is just a little sort of, again, tip of the iceberg of the information that we would need to do the kind of work that you're wondering about and that we'd like to do. So nothing yet, but we're working on it.
Great, thank you. All right, I think you can keep going and we'll see if any more questions come in as we go.
Okay. So I want to move us to talking a little bit about our organization's trying to take a look at community risk factors and community protective factors. This is something that we're just kind of beginning in the last year or so, just conceptually, again, moving outward from in that socio-ecological model from individual and family protective factors out to the level of the community. I think there's a lot of work being done on this question with a lot of other organizations as well. So I know we're in, perhaps some of you are doing this as well. So I know we're in good company, but I just wanted to offer some of the information that we've gotten so far and some of our thinking so far on this. It would be really interested to hear from any of you about whether you've got any ideas or done any work on this as well. So just in terms of defining the problem of child abuse at a community level, there's so many ways you could do it. One way that we've done it is to try to calculate the cost of child abuse, the economic cost within communities, and we've done this and analyzed data at a state level and the level of the San Francisco Bay Area and San Francisco itself. There's been a national analysis of this that I think was published by the CDC, and so the number that you see, $124 billion over the lifetime cost for victims of child abuse. I think that number was published in 2008. Our numbers for California, the Bay Area, and San Francisco come from an analysis that we did in 2017. So what we found was that, I'll go in reverse order. What we found in San Francisco was that there were $224 million lifetime costs for victims of child abuse in San Francisco, and we went out from there from from San Francisco to the Bay Area to California. And of course, those numbers only increased. $2 billion lifetime costs for families in the Bay Area, and 19.3 billion dollars cost for the state of California. So, however you slice it, of course, it's a big problem. But if we try to look at the level of community, this kind of quantitative and economic analysis can really be a motivator for communities and for policymakers to think about building prevention work in a community. And our analysis of that, I can certainly make this available to you as well. I don't think the statewide one were published yet, but we do have the San Francisco and the Bay Area analysis available, and also a tool that allows different communities to plug in factors and numbers from their own community and calculate their own economic cost of child abuse. We're developing that. I think it's ready. So if anybody's interested in that, certainly let me know, and I can put you in touch with the person here who can deliver that as well. So when we think about community, one factor that we think about, of course, is economics, and that's a little bit of work that we've done around that. When we think about factors that influence risk of child maltreatment, there are individual and family risk factors, and I showed you that list, but we're also beginning to develop a list around community factors that have to do with some root causes of child abuse, around economic inequality and poverty in particular, family violence, which certainly touches on other root causes in communities and in their society around racism and institutionalized problems. So socioeconomic inequality, I won't read the whole list necessarily, but one thing that we found that we didn't necessarily think about before is this last item, and it's a big factor in California. It may not be for you, but is wildfires and natural disasters. The Tubbs fire in California a few years ago, which happened in Napa and Sonoma counties, which are regionally part of the Bay Area, really devastated those counties. And what we saw was an increase in child maltreatment reports in those counties after the fire. And what we're thinking about, and of course we need to do some more research and more understanding, is that a natural disaster like that really wreaks havoc with the community in so many ways and affect these very factors like unemployment, homelessness, substance abuse. And so things like natural disasters, which you might not think are risk factors for communities, are actually seen to be integrally connected with these other factors and can pose risks to communities. And let's also think about community attributes that strengthen families. On the flip side, sort of economic supports and resources for all families, stable housing, equitable access, education, quality childcare, and positive social norms around supporting kids and talking about abuse with kids and talking about safety with kids are all factors that we seek to strengthen in our community. So that's some of the beginning of our thinking about that, about community protective factors, and there's a long way to go. But again, I know we're in good company. I would love to hear from any of you about this as well. So we have a little bit of time for discussion and questions. You may have your own thoughts. I just wanted to offer these as ideas for thinking about, could a process like what I've described or any elements of this process be adapted to serve the needs of your population? And what would your program need in order to implement and benefit from elements of a process like this in terms of staffing, data system, data analysis, program design? So there's some thoughts about what might start a discussion, but I'm interested to hear anything from any of you. Thank you very much.
Thank you so much, Malcolm. We do have one question that came in while you were speaking, and maybe other folks will type in their responses to your questions too. But for now, we have a question from Christina Betancourt Santos asking, do you have a system for knowing when to exit a family? So sort of when the family moves back from that darker circle of integrated family services to the supportive services? Right, yes, we do. So we have a set of kind of scores on the PAPF and on the NICFAS that we sort of call it, sort of think of as a threshold for sort of adequate protective factors. And when a family reaches those quantitative levels as measured by those tools, that's one signal that a care coordinator can have to begin to talk with a family about, it looks like you're doing much better than you were before. You've reached some of these goals.
your scores have increased to this sort of level that we think of as being adequate protective factors, and begin a conversation with a family about whether they're ready to sort of disengage or go to a lower level of service. Of course, very often what happens is families themselves will say, I've gotten enough now. I'd like to, let's pause, let's stop. That's enough. I want to disengage. And maybe quantitatively they're not, they haven't reached our definition of adequate protective factors, but that family themselves are articulating, we've got enough of what you're giving us, and so we're going to stop. So of course, a family initiates that conversation whenever they need to, but we do have some quantitative ways of measuring that as well. And even when families don't, when they leave that level of service or they disengage and they haven't reached that threshold, we also have a way of tracking sort of the change that happened over time, so that it's not just a binary thing like, yes, you reached it, or no, you didn't. And if you didn't, it's a failure. We are able to look at, okay, what change did happen over time and what was accomplished. So I hope that helps.
Excellent. We have another question that came in from Melina Yepes. Sorry if I mispronounced your name, Melina. Her question is, where does historical trauma of racism fit? Community risk factor?
It fits all over the place, if you ask me. I think in sort of community risk factors might be the most obvious place. We have on that list community violence, lack of affordable housing, unemployment. All of these factors are really connected with institutional racism and sort of those kinds of historical factors. But I would also say that that element appears even in that risk factor, risk indicator checklist that I showed you before. A family's own experience of maybe poverty, maybe racism. I think we have those elements listed right on that checklist, are really present when we're engaging with families. And a family themselves may or may not identify those sort of historical trauma and racial trauma elements in the narrative that and story that they have about their life and about their family. But we certainly try to be aware of that, the presence of those factors when we're working with families.
Thank you. We've got another question. This is from Maureen Durning, asking, what about the staff's own protective factors? We have found that you can't teach what you don't know, and care must be taken to support staff from burnout, etc.
Absolutely. So when we do, so I can answer, that has sort of two elements in my answer. I've got 3 minutes. So when we're onboarding and when we're training new staff about the protective factors, we encourage them to think about protective factors in their own life and their own family, especially sort of frontline folks who are going to be working with clients directly, but even folks that are working less directly with clients or less often, we really encourage, when we're training about the protective factors, part of that it really is, okay, take some time and think about, now that you know what these factors are, which ones were present in your own life and in your own family. And we encourage people to think about that at the very beginning of their time with us. But also throughout, here in San Francisco, we have a trauma-informed systems initiative. It's citywide, but we've adopted it in our organization as well to try to understand and think about the effects of vicarious trauma and secondary trauma on the work, on staff members and folks, and helping professionals that are doing this work. And that initiative really takes a look at what's necessary for the system of the organization to do to support people who are working and helping families within the system, so that the system that's intended to support families doesn't simply sort of re-traumatize staff or traumatize staff and people who are working in that system. And if you'd like more information about that, there's a lot available, and I'd be happy to point you toward it.
Thank you so much. Those are all the questions that were typed in, unless someone is still furiously typing their question. But I think this has been really great information. It's wonderful to see the level of detail you're able to get from your data and to share about your process. I think a lot of people got a lot out of this. So thank you so much for presenting.
You're welcome.
And
Thank you for asking
I know that we'll get those tools and the concrete stuff you're going to send me, so we can put it up on the website along with the recording of the webinar and the slides. So I just want to thank everyone for joining us today. I think it's been a really good conversation, and I think lots of people are leaving with new ideas about what they might be able to do in their own settings. Thank you, Malcolm.
Okay, thank you, and thank everybody for your time.
All right, have a great rest of your day. Bye.
You too. Bye-bye.